You also have a non-ablative option on your Optimus Max called the Forma. This is a flat, planar, bipolar technique. RF flows back and forth 1,000,000 cycles per second. We get to our cutoff temperature pretty quickly, and we monitor it with ACE and control it. We keep that skin at 41, 42, 43 degrees for 10, 15 minutes once a week for 6 weeks or once a month for 3 sessions with the Morpheus, and you're going to get dermal remodeling with no downtime. So you think, oh, well, why not just use the Morpheus? There is usually downtime and discomfort. The Forma has no pain. And so it's often bundled with IPL or Morpheus. And so let's go center screen clinical treatment. Let's look at the Forma. If you look at the center electrode on the Forma, it's positively charged. 2 negative side electrodes. That's a flat planar technique. RF flows back and forth 1,000,000 cycles per second. Inside the tip are sensors that measure contact and temperature 1,000 times a second and adjust the RF output 1,000 times a second. Now that same Forma technology is on the Forma I for dry eye, very delicate area, in the vaginal canal with the Forma V, hands-free on the Transform or the Define, and now on the Apex for the penile shaft. Temperature-controlled bipolar RF, because 43 degrees is good, but 44, 45 is out and a burn. Being able to control that exquisitely is the IP of InMode. So right over where we did Lamecca, Shelby's going to start moving in little circles and figure of 8, get up to 43 degrees pretty quickly. Show us the front of the machine over there, and just point out our temperature cutoff. We'll just wait till we zoom in there. So the temperature cutoff is 43 degrees. We have 40 of energy. We could go up to 60 if you want to be faster. It's continuous. And if you look at the top there, it's got the real temperature, and that real temperature is going up. It started in the mid-20s. Now it's 32. It's going to get to 38 and then start to go beep, beep, beep. It's going to warm at 41, warn Shelby. It's getting close. And at 43, it's going to turn on and off as long as she wants. Typically, most protocols, 10 minutes an area. So 20 minutes for the face, maybe another 10 minutes for the neck, once a week for 6 weeks. If you combine it with Morpheus, once a month for 3 sessions. Why would you combine it with Morpheus? More dermal enhancement than the Morpheus gives you, which is more FSN and dermal remodeling. No disposable, no consumable. So you're in front of the screen there. Let's go back to our patient, and let's continue the journey. And so Shelby's heating over the same skin you did with Lamecca. I like Lamecca first, Forma second, Morpheus third, in that order. If you've got your topical anesthetic cream, you could do Morpheus first, Lamecca then Forma.